Cushing syndrome. Which of the following would the nurse expect to note on assessment of the client? 1. A drooping on one side of the face. 2. Skin atrophy. 3. A rounded moon-like appearance to the face. 4. The presence of sunken eyes. The correct answer is 3. A rounded moon-like appearance to the face. The nurse is performing an assessment on a client with a diagnosis of mixed edema. Which of the following assessment findings would the nurse expect to note in this client? 1. Thin silky hair. 2. Dry skin. 3. Fine muscle tremors. 4. Bulging eyeballs. The correct answer is 2. Dry skin. A client is diagnosed with the dysfunction of the adrenal medulla. The nurse monitors for changes in client status related to altered production and secretion of which of the following substances? 1. Cortisol. 2. Epinephrine. 3. Aldosterone. 4. Androgens. The correct answer is 2. Epinephrine. A client has a tumor that is interfering with the function of the hypothalamus. The nurse would expect that the client would exhibit which of the following clinical problems? 1. Glucocorticoid excess or deficit. 2. Mineralocorticoid excess or deficit. 3. Antidiuretic hormone excess or deficit. 4. Melatonin excess or deficit. The correct answer is 3. The antidiuretic hormone excess or deficit. The nurse is performing an assessment on a client with a diagnosis of hyperthyroidism. Which assessment finding would the nurse expect to note in this client? 1. Periorbital edema. 2. Chords, facial features. 3. Dry skin. 4. Bulging eyeballs. The correct answer is 4. Bulging eyeballs. A nurse is reviewing the postoperative orders on a client who had a transsphenoidal hypophysectomy. Which of the following physician orders, if noted on the record, would indicate the need for clarification? 1. Apply a loose dressing if any clear drainage is noted. 2. Instruct the client about the need to wear a medic alert bracelet. 3. Assess vital signs and neurological status. 4. Instruct the client to avoid blowing his nose. The correct answer is 1. Apply a loose dressing if any clear damage is noted. A client suspected of having primary hyperparathyroidism is undergoing diagnostic testing. The nurse would assess for which of the following signs that accompanies this order? 1. Polyphagia. 2. Weight gain. 3. Diarrhea. 4. Polyuria. The correct answer is 4. Polyuria. A client's serum calcium level is high. The nurse plans care knowing that which of the following hormones is directly responsible for maintaining the free or unbound portion of the serum calcium within normal limits. 1. Thyroid hormone. 2. Parathyroid hormone. 3. Follicle stimulating hormone. 4. Adrenocorticotropic hormone. The correct answer is 2. Parathyroid hormone. The nurse is reviewing the laboratory results of a client with a diagnosis of Cushing syndrome. Which laboratory finding would the nurse most likely expect to note in this client? 1. A blood glucose level of 110 mg per dl. 2. A potassium level of 5.5 mg per dl. 3. A white blood cell count of 6000 cells per liter. 4. A platelet count of 2 lakh cells per liter. The correct answer is 2. A potassium level of 5.5 milliequivalent per liter.